Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas. Sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you to grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm recording and broadcasting from New South Wales in Australia, and today gives me great pleasure to be talking with Dr. Christina Radics in Spain, on the other side of the world, where it is 8:18 in the morning. It's afternoon here. Christina, welcome to the Ultimate Dental Podcast. Nice to have you.
Thank you so much. Thank you for having me here. It's a pleasure to meet you, to hear about your story, and also to be sharing my story. And hopefully, I can help someone who's listening to this
So,
today.
Christina, you've got a very interesting history in life and in dentistry because although you're living in Spain, you're from Sweden, but genetically, your parents are one Greek and one Hungarian. So that's something in itself. But tell me about your career as a dentist and how you began in dentistry and what led you to be practicing in Spain and what led you to where you are today.
Wow, yeah, it's a long story because this was my dental journey started year 2000, but I want to go even further back because everything starts from your childhood and you become the person you are because of the environment you grew up in. So, just as you said, uh, I grew up with a Greek mother and a Hungarian father, and they were really different in their personality. In one way, it's really exciting because I feel like I have very different sides of me. I'm a DJ as well. I like to perform on the scene. I have always liked that. And that's why I enjoy being a presenter nowadays as well and a speaker. And my father has this very calm analytic side. My mother is this Mediterranean screaming lady who likes music and dancing, but they were really bad in communication. They were discussing every day. And why I'm bringing this up is not to criticize my parents. I think every parent tries to do their best, but we can't forget the consequences when we grow up in an environment where we hear conflicts and discussions every day. It gives us a very stressful environment. And it's during the first 7 years that the child will develop their thinking, their thought patterns. So I became a person who was a people pleaser. I wanted everybody always to be happy. I was very afraid of conflicts because for me, conflict was a bad thing and something you should avoid. And I'm not saying that every child will develop these kind of personality traits, but it can take different paths. You can also it depends of the trauma response, fight and flight. You can also become more aggressive, but for me, I became like this peacemaker instead. Um, it was very difficult for me to set boundaries in life, at work, etc. So you can imagine that this path is not the best when you want to become a dentist, where you have to have really high, good mental resilience. So anyway, so I became this perfectionist and good girl. So I had very good grades, but I also wanted to have children early. So I got married already when I was 19. I got Valentina when I was 20, Pablo when I was 21. I had good grades, and my mother-in-law one day said, Christina, why don't you study, become a doctor? And I was like, yeah, I want to, but I don't want to study for 8 years to become a specialist. And she was like, yeah, but why don't you become a dentist then? But I had no one in my family who was a dentist. I didn't know what dentistry was really, what a dentist. But I knew I wanted to work with people because I had been working in hospital. As in Sweden, you have something that's called undersköterska, like an assistant for the nurse. I don't know if you have it in Australia, but you're it's below nurse, so you're assistant to the nurse. So I was working in the hospital, so I knew I wanted to work with people, and I love that environment, helping out. Yeah, I was a people pleaser, so it was perfect for me. But so I entered dentistry, and there were many things that I loved in dentistry, but to be a perfectionist, to already be very self-critical and be a dentist is not the best combination. That's why I'm speaking a lot about nowadays, a lot about how we can help to find these signs early and give the right tools for the students. Because if you're a perfectionist and if you have a tendency to get anxious when you have overthinking, then you will think about all the fillings you made, all the crowns, or if if after the extraction the patient will have consequences, you will punish yourself when you come home. So since I can remember, I felt stress since the first day in dental school because I was pressuring myself so much. I had to know every little detail. I have to be I had to be perfect in every situation, and perfect for one person can be totally different to another. It's like an internal thing. And I remember in dental school we were not speaking about these things. We were speaking about how to have empathy towards the patients. That was not my problem. I'm a very empath. I'm an empath, so I feel a lot. And that's why, as an empath, as a dentist, you become very liked. The patients feel like you care about them. So, in that way, there were no problems. But I remember the last week in dental school, the teacher spoke to us and said, today I have to speak about one serious thing in dentistry, and that is that you have a high risk of developing depression, alcoholism, drug addiction, and even suicide. And this was 1 week before we graduated, got our license. And I remember I was listening to him, but I mean, I was so happy of becoming a dentist. We had been studying for 5 years. So it didn't matter what he would say. I would be like, that will not happen to me. I've been studying with two small children. I'm a tough person. So I started at the dental, yeah. But as I told you, I always wanted to live in a warmer country. So I wanted to try how it was to live in Spain. And I came in contact with the Scandinavian Swedish clinic. So I started at this clinic, and I worked at the same clinic for 18 years. That's not so normal, but I feel like you're building up this patient stock. No, you want to have your patient that will stay with you, and it felt like they were my family too. I could never separate work and life. That's why I'm speaking about these subjects, because I was the worst. I have done all the mistakes you can do. I have done mistakes that people are like, just like, are you crazy? I always wanted to give some extra value. I'm still like that, but now it's in control. But if a patient called me or wrote to me Friday evening or Saturday, I would respond immediately. Because for me, it was like I'm showing that I'm giving them extra value, and they will be happy that they have me as their dentist. But it will have consequences when you give more than you feel that you receive. And that's where the balance comes in. When you give more than you will receive, you will start to feel bitter. And you don't understand why. And you will develop burnout. So after 10 years, I didn't feel happy anymore
Yes.
to walk into the dental practice. And one morning I just started to, it was like a simple thing as one patient still had pain after an endodontic treatment, which is a normal situation. But that was just like the last thing. I just started to cry. And when we speak about burnout, I have not mentioned this so many, or I have not mentioned this in other podcasts, but there are so many small things. It's very difficult and complicated to explain what, because every day small things, when you say yes to things, you should say no. Then you have your personal life. 2 years ago, my son got cancer. So I was in between, and at that point I was the only dentist at the clinic. So being between your patients, your clinic, I was the clinic owner at that time, and being between his speaking with his doctor, being at the hospital with him at the same time that you're speaking with the technician about the color of a crown. You come to a point where you feel like the life of my child is much more important. You balance things and you see things from another perspective, and it's like, but even until the end, I was speaking with the technician while I was having the doctor in front of me, because I couldn't say no, because the patient was with the technician and she had to leave in 5 minutes. So there are so many situations that makes you suffer from burnout. But anyway, it happened after 10 years. But now as a coach, I have met dentists who have a burnout already in dental school after just 6 months as dentists. So we all have our own journey, and somebody never gets a burnout. And I will discuss a little bit about those things as well. So I was home for 1 month, and I started to take care of myself a little bit better. I thought that, at least. But then I was in the hamster wheel again. And it took me another 7 years. And then I would have another burnout. And that second burnout hit me much harder. And it felt like, even though I had more experience, I became better at delegating. It was always something that came up. Or maybe I had invested in a scanner that didn't work. So those technical problems as
Yeah.
well. So it's not just people, it's not the patients, it's not the staff, it's an accumulation of so many things. And that's why we have to have the tools to be mental resilient, to bounce back, to know when to say no, to be it's like somebody in a TED talk, they said about work-life balance as, when you're, how do you call that in English?
Juggling.
Juggling, yeah. Juggling with balls. You have to know how to juggle and take care of yourself. It all starts with yourself. You can never give more to other persons when you give yourself what you give yourself. It's not sustainable. At least you can do it. I could do it for 10 years, but then it will come a breaking point.
So, two burnouts in an 18-year career as a dentist saw you
Yeah,
walk away from dentistry as a career. And now you're helping dentists and health professionals by coaching them and helping them to identify these issues that you had so that they
yeah.
avoid the pains and the tribulations that you went through. Tell me about that. How's that been as a transition for you from hard skills, drilling teeth, to now dealing with
Yeah,
soft skills, which is emotions and feelings of healthcare practitioners?
yeah.
How's that been?
It feels so good. It feels like I'm home. One thing I didn't mention is that I wanted to become a psychologist before I become a dentist. Before, but I remember thinking, maybe I will not earn enough. Maybe I will not be secure enough economically if I become a psychologist. The soft skills, the psychology has always been my big passion. And it's incredible how life takes you on different journeys. But if you're not on the right path, it will try to take you on the right path. So now I love dentistry. I love working with people. But this mission that I feel now is so strong. I feel so needed. Unfortunately, not many dentists, and I totally understand them, and not many people, you're not really understanding when you're in the burnout because you just feel different. But it's difficult to say, you don't really know that it's not like today I don't have a burnout, tomorrow I have a burnout. It's not like a fixed line in between black or white or bad or good. It's just like you enter this cloud. You just feel detached from yourself. So what happened was, so 2 years ago, I went out with my dogs. I had a period of a lot of stress. I started to feel detached from myself, but I was still working, and I went out with the dogs. It was a beautiful sunrise, but I just felt so empty. I didn't have any more energy for my patients, staff, family, husband, children, and I even questioned, why should I be alive?
Oh my goodness.
That was like, but I had an angel that morning watching over me because I just felt like these are not my thoughts. Something is going on. So I took my mobile, I called my mom. She lives in a small village in Greece. So my father and mother divorced when I was 10. That was good. So I called her and I said, Mom, I don't recognize myself. I think I just have to slow down. And I don't know why I realized that, but I just had to push like a pause button and find myself because these thoughts were not mine. So I went on a plane, and I have such a good husband, supporting husband and children who really they understood that something is going on and you have to find yourself again. So I went to my mom, and my stress level was so high I couldn't hear a mobile phone calling. Like everything just got me stressed. So step by step, but I had a plan. I was starting to journal. I meditated, and I walked outside by the sea. So step by step, each day, I I felt like myself again, and I started to research. So I started to look on internet. What do they say? Why does this happen? I am a strong person. Why does this happen? And I found a book that I really can recommend. If you haven't seen it, it's called Depressive Illness: The Curse of the Strong. Have you
No,
seen
I
it
haven't.
before? Tim Cantifer. He's a psychiatrist. And there were a few things in that book that just, it was like a puzzle, and suddenly I could see what was going on, and I got the answers. So when he describes the people who get burnout, he says, it's often the person that you least expect will get the burnout. He or she will have the following personality characteristics, because he found out that when a person came into his clinic because of burnout or depression, before they told about their personality, he already knew. And it was this: they have very high moral strength, they are very reliable, they have diligence, strong conscience, strong sense of responsibility, a tendency to focus on the needs of others before their own, sensitivity, vulnerability to criticism. Self-esteem is dependent on the evaluation of others. So you do everything just for other people to like you. You can go so far, but just you cannot stand. I could not stand that somebody would not like me. I had to have my own coach and therapist to straighten that out, because that's the hardest thing when you're a people pleaser. It's not just to say, but just say no. Just say no. Like, everybody don't have to like you. It's not that easy. It's a work you have to do with a therapist or a coach, to accept yourself and be loving yourself to that extent that even if somebody don't like me, that's okay. And I'm there today, and that's freedom. You don't have to like me. I'm doing my best. I try to be the best person I can be, but everybody don't have to like me. So that helped me a lot to read. Knowledge is power. When you start to read and see, why does these things happen? Why do we understand that we have to close our laptop? Because it will get overheated if I have it on all the time. But I cannot understand it when it comes to myself. We are not logical in that way. But some people have it, and I think it depends a lot of your environment. How did you grow up? Did you grow up in a family where you could see how mom and dad were solving conflicts, were speaking in a good manner, were listening to you, where your opinions matters? Because if you have two parents that discuss a lot, it's not that they don't care about you, but because they are so focused on their problems, you become like a little bit in the background. They forget about you, neglect you a little bit there.
So is this a common theme you're seeing amongst your clients, that they've had difficulty in their childhood with their relationships with their parents, coming from uh, a hostile parental relationship?
Yeah, it doesn't have to be hostile, but that maybe the high pressure, like, it was never really enough. Like, you could always improve something. Yeah, you're good, but you could, if you have parents that it's never really enough. And those persons will have a drive force. Like, you will become strong in one way, but if you're strong because you want to please everybody, that will not be sustainable. But many children to parents who always found that they were never enough, they will become high achievers, because that's their drive force. It stays with them, but it's unconscious. I was not studying dentistry or being a perfectionist because of my parents. It was an unconscious thing, because it's already set during your first 7 years of childhood. So it's not a conscious thing, it's your pattern, that you were not really seen or enough. So you will always be driven by some level of perfectionism. So, yes, I will answer your question. As a coach, I'm looking towards the future. A psychologist works with the childhood and solves and speak a lot about the past. I'm speaking about the future. But it is true that sometimes in the during the speech, during the discussion, you will hear that the childhood has been a little bit tough, that they have had high expectations. So yes, being a perfectionist is a trauma response. For one, we are more or less we are perfectionists as a dentist because we work in a small area. So I'm not saying that everybody has a trauma response, but if you continue punishing you and you can't see when it's enough, that's a sign that something is not really stable inside you. So just wanting a good result, that is not perfectionist. Perfectionist is when it's never enough. You can never be really satisfied or say that this was perfect. You will always find something you did wrong.
Certainly, perfectionism is about, can I do something better than I've just done it?
Mm,
But there also has to be in some things, there has to be a finish line where that's,
exactly.
you've achieved a result and you're happy with that result, as opposed to, I've heard people say, well, that's the best I can do, when the best they can do is unsatisfactory. So there's a difference between those people who underperform and say, well, that's as good as I can do. That
Yeah,
those people need to go back and learn how to do things. But you are right. There are people who
that's
will deliver a good product and then say, all right, and that's the Chick-fil-A model. We've delivered great customer service. Now,
yeah,
how can we make it better? Let's just
yeah,
not rest on this. Let's be ready, because somebody's going to copy this, to be ready for our next improvement. And so that's always a thing. And that's what I found in my practice in dentistry, was that how do we make this patient's visit today better than when they were in last time? And how do we make their next visit better
yeah,
than today? And when we think on those terms, we're just delivering a better experience. And you
yeah,
mentioned at the start about knowing soft skills, and how we discussed before we came on air how most dentists just talk about thinking that hard skills are enough. But you and I both know, Christina, that when you go to a barbecue or a, a cocktail party and you tell people you're a dentist, they don't pull back their lip and say, look at the margin here, only 15 microns. My dentist's the best, do they? They always tell you how good their dentist made them feel and that they wouldn't go anywhere else,
yeah,
because they assume, as we were talking, that all dentists have the same level of skill. And so, if all dentists have the same level of skill, how do we differentiate whether our patients appreciate us or not? If we focus on our skill, we will be underwhelmed with the response we get, because the patients don't know the difference between 15 or 50 or 100 microns in there. But what they do know
yeah,
is that you didn't hurt them with the injection, that you talked to them like they were a human being and not just a tooth with a credit card. And those are the things
yeah,
that dental schools fail to teach dentists. You know, dental schools fail to teach dentists a lot of stuff, even just CPR and stuff like that. I'll learn that when you graduate. But soft skills,
yeah,
it's kind of like, ooh, well, we don't know how to teach that. And so the burnout that you experienced is not just unique to you. There are people who have left dentistry who had good hands, but and were good
mm,
people, but they weren't trained to control their emotions and use
mm,
their emotions for good, for helping people to get the dentistry that they want. But it's great that you're giving back, and you also mentioned that you're now giving back to non-dentists. So you're coaching a doctor at the moment, which is great.
mm,
Again, the expectations of some dental students is set, as you mentioned, by their parents or their family, saying, you're smart, you should be a, a dentist, or, as you and I were talking, a veterinarian. I got told I should have been a veterinarian or a doctor or a dentist. Well, I thought, cows can't tell me what's wrong with them. They're out. Dogs can't tell me what's wrong with them. I'm not treating them. At least I want somebody who can say, this tooth hurts when I have sugar. This tooth hurts when. Yeah, why is my blood pressure high? So that's tough. Um,
Yeah.
but there is a need to prevent burnout, um, and the loss of good people from the career of dentistry, and
Mm,
helping people to
mm,
improve their lives with being able to eat properly, being able to chew properly, and be able to
yeah.
smile and look better as well.
Mm, yeah. 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 I totally agree with you. There were several things you said that I want to comment. I was in contact with a psychologist who is in dental school in Stockholm, and he told that when I was telling my story, he said, "Yeah, that happened to you, Christina, but we also have a problem with dentists who are not empaths, who don't feel, uh, who we have to train how to think about the patients more." So, it's we every person is a whole world. We see life through our own glasses, with our experiences, our childhood, our environment. So what one person is suffering from can look totally completely different from the other person, but the other person maybe has to be trained in how to feel more, how to care more. So there are a lot of different things that has to be looked at. But as I said in another podcast, we have 5 years. I don't know how long the studies are in Australia, but in Sweden, it's 5 years. 5 years, it's a long time. We do have time. And when they say we don't have time, we have to teach the student so many things. But you can just do some role play, some smaller role play consistent during these 5 years. But as long as you have seen or heard a situation, and then you will remember it when you will be in the same situation in the future. You'll be like, oh, okay, that dentist, that teacher said it was okay for me to say no in this situation. You just need somebody to guide you. If you don't have that compass yourself, you need it. And so that's one thing I think that we should definitely incorporate in dental school. I really hope that one day somebody will hear me on the podcast and say, come, Christina, come and let's discuss what we could do, because we could do it as a fun thing. I know that the students are not, they have not been in that situation yet, but just recognizing it, just showing for them, small role play, that I think that can make a big difference. And listen to them, listen to their feelings. We have to bring in a little bit more vulnerability, because it's such a technical profession, but we are human beings. We are not machines. We are human beings with emotions, so we have to deal with that as well. um yeah, that was, yeah,
It's
it
difficult
was
because
something else, but I
dental
love.
school only teaches in Australia, and I was talking to a dentist in the United States about this as well. They only teach dental students the bare minimum to be able to drill teeth and fill teeth, and in fact, even less in terms of specialty. How to treat an orthodontic case, how to extract a tooth um, in the best manner. Um, these things are now taught by referral. And so a dentist, once a client of mine down here said she felt that all her dental degree prepared her for was to go and take her degree and go and work in a government run clinic run by the state government, where she would then learn more dentistry. And those who choose not to go and work for the government then have to go and find a general dentist who will teach them at that dentist's cost how to be successful in private practice, how to maybe talk with empathy to patients, and to help patients to come to the decisions of improving their smiles, and not just, I'll rip it out, I've got still got plenty of teeth, I can chew
Mm,
fine with one less. And
mm,
so dentistry, I think, has become too streamlined in what they educate at university, but at the same time, and this is probably a global thing, universities are seeing that people who want to become dentists are willing to pay large amounts of money to study, and so end up with an education debt. And so they actually graduate in the United States. They graduate $400,000-$500,000 in debt, which they have to pay back to the university before they get back to even. Then they have to buy a practice. That's another $500,000 to $1 million. Who would sign up for that sort of deal when you can go and become a software engineer, just buy a computer, use your brain, and be making money? I don't know who's lining up for those sort of degrees anymore. So what are we doing to the future of dentistry when we're subjecting undergraduates to that sort of penalty, which has got to be an emotional burden for them straight away? I don't know what it was like when
Yeah.
you studied dentistry, but education was free in Australia in the 1970s and 80s for university. So it cost, I couldn't have paid for it. My parents couldn't have paid for it. I was very fortunate. But nowadays, we're importing people from Canada to buy a degree because they can afford to, and because they are paying for a degree, they're a consumer. They expect a degree whether they're smart enough or not. That's not giving the population a good service in dentistry because, one, they don't have the skills clinically, and two, they definitely, as you and I have discussed, don't have the skills emotionally because they're not being taught those skills. What are we doing to dentistry? It's not a good mix, is it?
No. And the more stress, I think a big reason nowadays, everybody's so stressed, everybody's stressing. And what stress puts us in the default system. So we have 90% of repetitive thoughts. We all have, even if we think we are very unique. What you thought yesterday, you will probably think today and tomorrow. That's why change is so difficult, because you really have to go on this journey and be consistent and change a habit. We just know when we want to start to go to the gym how difficult it is. And there are different studies, like after 21 days, after 47 days, you have already a routine. And sorry, 1 second. Okay, I told my husband to to not let the dogs out, and now I saw the little one. So yeah. So when I had my second burnout, I actually, when I was in Spain, no, in Greece, and had time and was reading, I emailed, I emailed to 12 different dental schools, and I asked, what are you doing to prevent burnout for the dental students? Just one university answered me. Just one. And that made me first angry, but then sad. Because it's like, when somebody's not answering, it's like, or you're hiding, or you don't know, or is it better to not speak about it? And then when the student is out there, they feel like it's not as the reality, that their studies are not like reality. And that happens to a lot of dentists. I'm now coaching one dentist. He has been a dentist for 2 years, and he feels like it's not what he signed up to. It's not like what he thought it was. So it's so important that we actually look at it as it is. What's the problem? What is it that dentists are not happy with? Because we love our job, we love to help, but is it that we have too many patients during a day? Are we working too many hours in a small area where we know that we will have a lot of cortisol? And cortisol and stress will cause an inflammation in your whole body. So it will affect our heart, it will affect our mind, it will affect every organ in our body when we have these cortisol levels. And if you have a person who cannot disconnect when they go home, that would just continue. So what happened with me during every burnout, I couldn't sleep.
Mm.
And when you can't sleep, you cannot
No.
clean out the toxins in your head. That's why you come to a point when you feel like, should I be alive? It's not your thoughts. It's because your toxins that you have in your brain that are produced, that is a system that we have not known for so many years. It's called the glymphatic system. And that system is only activated during night. That's why it's so important that we sleep the right amount of hours and we have a good quality of sleep. Because during the day, we will produce half a liter of water with toxins in our brain. But it's only during the night that these toxins are washed
Mm.
away. That's why we wake up with clear mind and clear thoughts. And it happens to me a lot. I don't know about you, but I wake up with a great idea for a post or for something. Like my brain is like new. But when we are stressed, we sleep bad. That's when we wake up between 3 and 4 in the
Yes.
night.
Yes. And it's interesting. I was talking to a pharmacist friend of mine about the importance of unbroken sleep on general health, and some of the
Yeah.
things that affect that sleep are, you know, are discounted. Pain, joint pain, back pain, um, can wake you, and you think, "Oh, it's my bladder." Sometimes, sometimes men are going to, "Oh, I'm awake. I may as well go to the bathroom," but it's not the call of the bathroom that's waking them up. It's something else. It might be a little bit of arthritis. So it sleep is so important in terms of
Mm,
creating
yes.
health. And
Yeah.
it's funny, when I was younger, like even last year or the year before, I could work late into the night and get up early. But now, as soon as I feel tiredness, it's like close everything down, go to bed, and try and get 7, 8 hours sleep. Even though I get up early to exercise, I'll go to bed early because there's no point pushing on through that through that evening unproductively.
No.
It's really important, but your body does need that recuperation, and so does your mind. Your mind needs that rest as well.
Yeah. Mm,
Do you sleep with a
yeah.
notepad beside you?
I'm
That's
so
okay.
sorry. I just have to take the dog. Can we cut the
Do you want me to
waves?
pause?
No, no, it's okay. I'll just, I don't know why my husband didn't. Let's see. I'll just take the dog. Okay. I'm so sorry.
That's okay. So, are you one of these people who sleep with a notepad and a pen beside your bed in case you wake up with a good idea?
Well, I have my phone, so I'm emailing myself. So when I get the good idea, yeah, that happens a lot. And one thing that has helped me lately is that when I meditate before sleep, I wake up with good. First of all, I have a very good sleep. I sleep the whole night without any interruptions. It feels like I have good quality of sleep, and they have shown in studies that that helps. And then often I have like a great idea as well. Do you meditate?
No, no, I do. Every morning I walk for 100 minutes, and I listen to music, and there's no traffic, so it's just I listen to music because it gives me a bit of a beat to walk to. Um,
What kind of
I
music do you
listen
listen
to
to?
rock and roll from the 60s and 70s and 80s.
60.
Yeah, that's my
Yeah, that will keep you in a great
it's
pace. But that's what they say. When you walk, you get 4 times more ideas and greater ideas, unique ideas, compared to people who sit and try to come up with ideas.
It's interesting. I did a walk a couple of years ago, which was 5.5 hours. It was 35 kilometers to walk it. And I thought, I'm going to listen to an audio book. And I put the audio book on, and the voice was just so grating to me. And I thought, no, I can't listen to this and think and keep a pace. So I just went straight back to the music. And so I'm one of these people that because I know people who will listen to podcasts, but if I got to listen to a podcast, I've got to be able to write things down. I've got to be able to
Yeah,
make notes. And so I just can't
yeah,
hope for osmosis to sink in. Sometimes I have to go back and do things. But I have it's funny, last springtime, I started listening to some coaching on sales techniques, and they were short lessons, which was great. But as soon as winter came, I'm walking with gloves on, and I can't be going to the next lesson. Got to take my gloves off. It was too cold, so I kind of said,
does it get cold in
"Oh yeah,
winter
we'll
time
get down
then,
to zero
or
in the
also?
mornings. Never any snow, but we'll get cold
Yeah,
or with a bit of wind chill under zero. At the moment,
yeah,
it's still a bit cool here because we're 700 meters above sea level, so we get four seasons. But it's
yeah,
interesting. Each to their own. Some people walk and
yeah,
and want to talk to people and talk to whoever's coming along, and other people would just wave or that's a good thing about carrying your phone because it's measuring. If somebody's coming along and I don't want to talk to them, I just go, I'm on my phone. But I'm not really. I just don't want to talk to them because I'm I'm focused on what I'm doing without that
yeah.
same old conversation of oh,
But that is setting
yes.
boundaries. That is good. That is setting boundaries. You're listening to yourself, what you need, what you want in that moment, and that is
Well,
good.
you've got to be. I think you have to be clear on what you allow into your brain as well, and that's really really important. And some people out there don't do that. They go somewhere to sit and socialize, but they just talk about the same thing day in day out. And as you get older, the more people talk about is they talk about their ailments more than anything else. Oh, feeling sore here, I'm feeling sore there, and that's not really good either. You want to be talking about positive things and
Yeah,
experiences and pleasures as opposed to
yeah,
ailments and disabilities.
absolutely.
But getting back,
Have you always been self-aware? I'm just curious. Have you always felt what's right for you, what you want, what you don't want, what gives you energy, what
I've just known that I've got to
doesn't?
get things done. That's it. It's about uh, I can't I can't leave something just festering and just I've got to make sure that it's either completed or it's surrendered. And more often than not, it's
That's great.
completed. I'm an achiever, and I'll find a way of getting
Mm.
things done and then move on to the next project. But you and I were talking before we came on air about you can't have 10 projects going at once. That's just crazy because that creates that's clutter. That's mental clutter, and it
Yeah, yeah.
bogs you down. And even if you
Mm.
live in an environment of clutter, it can actually lock your brain into immobility. And so you need to make sure that your
Yeah,
environment is comfortable and that you enjoy
yeah.
being in your environment and it is a pleasant place to work from and a pleasant place to live and a pleasant place to come home to. And that's really, really important.
That's so important. That's so important what you just said. Clutter. That's a good one.
Well, I think a lot, when I sold my practice. Now you're interviewing me, but when I sold my practice, when I finished there after 28 years, that was more than half my life in this one building, and I've not lived in a home for 28 years. I left. My parents had two homes that I remember. So from age 5 through to 23, I lived in, a home during primary school and a home through high school and university, and then as a as a as a an adult, my wife and I lived in one home for 9 years and another one for 16 years, and this home we've had for 12 years. But 28 years in one office, 4 days a week plus weekends,
Yeah.
driving to and from that office all the time. That's a big
Mm.
that's a big commitment to stability. And I had a friend who graduated, and when he graduated, he took two part-time jobs, and every year he changed one of the part-time jobs. So he's only ever in each job for 2 years. And we said he's never been in the same place long enough to see his dentistry fail. His dentistry would last to, and then he was off, move somewhere else, and that was what he was like. So those of us who bought an office, and stayed in that office for a career, 30, 40 years. In fact, one of my good friends got a job, and then after 1 year bought the practice, and then when he retired, he closed the practice down because the suburb had changed, the environment had changed, and he got more money for selling the property than he would have if he just sold the practice and kept the property as an owner. And so his whole career was in his 40 years in one location. Interesting. But some dentists,
Yeah.
some dentists will jump from ownership, 5 years here, 3 years there, off they go. And
Yeah.
again, never, I think one of the enjoyments of owning practice was to see the patients age with you and their children grow up, and even their children
Yeah.
bring their
Yeah.
children.
Yeah. Exactly. That happened to me. They were like small children when I started, and then they were studying at university, and that's when you realize, oh, I'm getting older.
Well, you can't stop getting older. Well, you can, but there's not a really good choice in taking.
That's not a
Not a
good
good
option.
option.
No.
Um, how are you enjoying the coaching now that you're doing that full time? Have you found your purpose, or is this something that you see as being a stepping stone to an even greater purpose?
Good question there. Right now, it really feels like my purpose, but I do see a bigger picture. Like I said, I would like to be part of an education program, like a global. If we could sit down people from the whole world. You, David, you're good in making things work. So that would be great if you could fix this to bring a lot of people, but different from different parts of the world, different ages as well, because we need to listen to the young generation as well. We cannot only listen to the older ones with experience. Everybody has to say their thing and actually come to a good solution, because I mean we have a beautiful profession. We are changing people's lives. We are removing pain, but we're also making them getting a better quality in life. But we need it as well. We as dentists need it as well, and we're not speaking enough about it because people are afraid of us. I mentioned in my book that I wrote together with a coach, but please don't tell anyone. I'm mentioning one day that was also like a thing I got, an idea I got in the morning when I woke up. Like, dentists are like sharks. We never speak about the shark, the emotions that the shark has, because we are so afraid of the sharks. So we are so focused on our own fear. And that's the same thing that happens with patients and dentists. Everybody's so afraid of going to the dentist, and I understand. But that fear makes us less human. They forget that we are humans as well. We have fear. We feel their fear, but we cannot show it because we have to be the strong one, showing that we are stable, that we are safe, that they are in good hands. So we have all of these emotions inside us, and we don't know where to take that away. And some people know it. You go for a walk, you have boundaries, you have probably learned early in your life some skills that will make you more resilient. And then you have the people that don't have these tools that will be lost on the way.
Yeah, it,
So that's my bigger purpose to respond. That when I'm there in a group where we can do a global change. So I feel like the day I died, I didn't just help people that I was speaking with that found me, but on a global level, then I would be really happy.
I think we have a common purpose, because one of the things that um, drove me to want to help dentists realize that owning a dental practice can help them create a lifestyle that they enjoy was when I stumbled across a discussion on Dental Town, and got attacked when I criticized somebody for saying, well, why are you even bothering being a dentist if you feel this badly about your environment and what you have to do? And everybody said, how dare you insult this person? He's got a debt, he's got a student debt, he's got a practice debt, he's got a wife debt. He's just trying to get through to retirement so he can actually enjoy the rest of his life. And I thought, imagine being a patient in that practice. Like you expect that when you go to the dentist, that your dentist actually enjoys what they do and they have job
Mm,
satisfaction. And remember talking to one of my friends who was a dental coach, and I said, this is really bad. There's a high percentage. He said, David, it's more than half are like that guy. They just don't want to be there. They're just laboring through because they've just painted themselves into a corner. And I thought, that's not good
mm,
for the whole population to have to think that they're playing Russian roulette with their dentistry
mm,
because somebody just doesn't want to be there. And maybe that's the myth
mm,
now. We were talking about this, that they go to university and they don't realize it's going to be this much debt for a student, then this much debt to buy a practice. And all of a sudden, it's kind of like they've painted themselves into a corner before they even get out and get a degree.
mm,
Christina, when I went to university, I wanted to be a doctor and I missed out on that. But after 2 years of dentistry, I got the marks to change. But all my friends from school, didn't go to university. They were just trades and jobs. And I thought, I just want to get a job. I just want to start making money and enjoy life. And then so I thought, I'm just going to finish dentistry and see how I go at it. And that was a really good choice. After a year, I fell into a very good job. After 3 years after that, I bought a good practice, what I thought was a good practice, but then the guy stole half the patients and took them away, so I had to build it up. But I did build it up. But I made that practice a success, and so I knew that dentistry was just my vehicle for career success as a business person. And I probably could have been a more successful business person in something else, but dentistry, I, I was good as a dentist, so that there was some
mm,
satisfaction in that. But you asked me, why, you know, why did I have this career, and how did I manage my challenges throughout my life? Well, you just have to do what I have to do. I never failed one test in my whole life, and that was to get my referee ticket in rugby. I failed the first test because it's a live thing. I go, oh, I'm going. Well, I'm not going to let that happen the next time. So I passed that, but I passed my driver's test. Never failed a test in dentistry all the way through. But I worked out that
mm,
after second year, when I got the recognition to go into medicine, I got no prizes for that. In third year, I came first in preventive dentistry. There was no prize for first in preventive dentistry, so I scaled back. Fourth year, 12 subjects, 12 passes. I just worked my way through knowing what I had to do, and then learnt some business
yeah,
outside of dentistry. In fourth and fifth year, I was working 5 nights a week as a barman, and then doing dentistry through the day because I was learning some sales and marketing skills, some customer service skills,
yeah.
and that's what I did. But anyway, it's
What would you choose if you wouldn't be a dentist? If you wouldn't become a dentist?
You mentioned it right at the start, what you did. I actually wanted to be a radio announcer. A
A
radio
what?
announcer, a DJ.
Ah, yeah.
And so I've done that in late adulthood. I've done community service radio, but that's an environment like, sometimes it's an environment like body corporate. Sometimes a body corporate is so much people arguing over a tiny little bit of real estate with a budget less than what a dental assistant earns, and you go, what are they? This is not the United Nations. This is just what are they so wound up? I'm out of this sandpit. And so I've worked in three radio stations. One, two, three. One I went back to, and of those four experiences, two were really good, and two were, toxic leaders who just wanted to control a
Mm,
sandpit, and weren't community oriented as well. The thing about community radio is that it's a blend of so many different cultures and people, all part of the community. So you can't just dictate that the radio station will be just this music or just this style.
no.
You've got to allow different genres, and
Yeah.
it's an interesting thing. I've been out of radio now for 4 years. I still listen to some of my friends. I love their shows, but yeah, different. Anyway, Christina, we've run out of
Yeah.
time.
But now you have a show with that. But I want to ask
Yeah,
you, David, a last
yeah, okay.
question. So, I know you're in the global dental network, you're in Advance My
Yes.
CE, or are you? uh, and you have your own coaching business and these podcasts. So, what is your purpose, mission?
Well, I think my mission in dentistry now that I'm not practicing, Christina, is to help dentists realize that there is a way from graduation to retirement that is a straight line. And my role is to help dentists to stay on that straight line and not to be distracted by clutter and obstacles and speed humps that get in the way, and detours that take them off that line. And you've seen, what people think success is. They think it's a straight line, but in reality there's a lot of detouring. And so my aim is to help remove that detouring and help dentists, and to be their coach in business, to be their sounding board, to make sure that they they reduce their errors and get to their end result quicker. Owning a dental office is a
Yeah.
gift. And if you own it and run it correctly, it will allow dentists to live where they want, to send their children to school where they want,
Mm,
and retire when they want to. But if they do it wrong, it's a sentence.
mm,
It's a prison. And the trouble is, a lot of dentists
yeah.
are very proud in their head. Oh, I don't need help. I'm smart enough to be a dentist. I'm smart enough to work it out for myself.
Yeah.
And they're not. And they
Why do you think that happens in
Oh,
dentistry?
because they believe that they were smart enough to get into dental school, they were smart enough to get through dental school, they can work it out. And yet the statistics
Mm,
are that 95% of dentists getting to now age 70 still can't afford to retire because they haven't saved. They've either not earned enough or they've spent too much along the way. And so they just keep working. They say, oh, I love to keep working. Well, nobody loves to keep
mm,
working. If you were given $50 million and said, "Do you want to keep working?" You're lying if you said, "Yeah, I want to keep working." And so retirement.
But I would love to sit here and speak with you.
Well, some of the results I get from my clients is life changing in terms of, just they come with really bad models, and I say, "Who gave you this model? Where did this come from? Why are you doing this?" And simplifying things rather than complicating things. Dentistry and running a dental business is simple if you do
Yeah.
the simple things well. And so that's my purpose
Yeah.
with Michael and Advance My CE, is to help dentists to get on that straight line and avoid the clutter, help them find the right education, help them
Yeah.
find the right products without having to go to Net 32 and look for 1,400 different pairs of gloves to work out which one's the best. That's just silly.
Mm,
And so in coaching, I'm giving back. If I can do it, I'm
yeah.
I'm no superstar in terms of everything I've learned from other people. And so my role is to help other people who want to learn to be better at
Mm,
dentistry than I was. That's my goal.
mm,
So that's the short
mm.
answer. And I think that's a
Yeah,
good it's a good answer for any coach. We just want to help people to
yeah,
remove the speed humps and to get
mm,
to get to the end of their career and enjoy their retirement. Nothing worse than hearing about a dentist who's had a good practice, has to sell his practice, sell his house, and go and live in a small house somewhere else, and then count his pennies because he hasn't got enough of them. That's not a life
mm.
with purpose.
No,
And I think that you're on the right idea of helping dentists to, when they get that emotional turmoil, to help them. There is
yeah,
somebody to help them.
yeah. That is clutter. I was thinking about that when you're saying that is clutter when you have too many
Mm,
emotions that are working as roadblocks. You can't see straight because the emotions are there and cluttering.
it is. And so, it's,
Mm,
there are some people that when you tell them, if you tell them to do two things and they only ever do the second one, they forget what you told them first, and that's a mental processing issue. And with those people, then you've got to
mm.
stop telling them two things and just tell them one thing. But you know what's like, I want you to
Yeah.
stop doing this and I want you to go and get that. And they just go and get that. And you go, what about the second thing is actually dependent on the first thing. And you go, oh, it's just
Yeah,
how they are. But once you
yeah,
learn how to deal with those people, they're still very
yeah.
productive. You just have to, not everybody thinks in twos and
It's,
threes, but that's why we have three blind mice, three little pigs, the three wise men. People really can only manage three things at a time, sometimes less. So don't give them four or five. There's no point in giving them six, seven, eight. You know, yeah.
no, 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 no.
How many people can how many people can recite the Ten Commandments? None.
No,
But we all
none.
know what Huey, Dewey, and Louie. We all know who they are. Donald Duck's nephews.
That's true.
We all know them.
Yeah,
Anyway, Christina,
yeah,
it's been great talking with you. I'm so glad that we've gotten to this. This has been two false starts. One because of the weather down here, and two, you had a sore throat. So we've finally gotten it
yeah,
down, and this has been a great
yes.
interview, even with the barking dog. What's the dog's name?
Ari,
Artie.
Ari. It's Greek.
What does it mean?
I think it's a Greek god, Ari. Yeah, I'm almost sure. Yeah, it was my mother's dog that we got. So I have two actually.
Oh wow! What
So
sort of dog? What
one
sort of
big and
dog
one
is he?
smaller. He's a Bichon Maltese, so he's small, white, and the other one is a black water dog. So he looks like a sheep, like furry. Yeah.
Oh wow! Well, we don't have a dog. We've had two. Jane had one as a child. I had one as a child, long term, and then we had one for 10 or 11 years before. Sorry, after we got married, and then through the children. So the dog got moved back out of the house and whatever. But we love them. But they can be hard work, especially if they start eating the house, destroying fly screens, chewing furniture, all that sort of stuff, clothes. They can be quite destructive. So we love dogs, but they're also hard work if you've got to travel.
Yeah, yeah, yeah. That's
Mm.
true.
Anyway, Christina, it's been a pleasure talking with you. Now,
It
the uh,
has.
the best way for people to get in touch with you for coaching is how?
Yes. First of all, it's I'm on social media. So I'm on Instagram. I'm on both as coach and DJ, and then with my name, Dr. Christina Radics, or Christina Radics with X if it's DJ, the artist name. And then I'm on LinkedIn, Dr. Coach Christina Radics. But the easiest way maybe would be ChristinaRadics.com, my
All right,
website.
lovely.
And there I have a link where anyone can just book an appointment with me. It's totally free. If you just want to speak, you just need to speak with
Oh,
someone. So that is always available. Or you can email me, but you find everything on my
and
website,
and
ChristinaRadics.com.
also you're an educator with advancedmyce.com, so people can find you there as well.
Yes,
So that'll also
yes, yes.
feature in our contact information. So, Christina, thank you very much for joining me on the Ultimate Dental
Thank you.
Podcast. I've really enjoyed talking with you, and I look
Me too.
forward to hopefully maybe meeting you in person one day.
Yes, I would love that.
Thanks very much, Christina.
Thank you. Thank you very much for having me.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favourite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.